Why did you do this study?
Many controversies remain on the clinical and histological findings of extramammary Paget disease, such as local recurrence rate and the frequency or broadness of Paget cells distributing beyond clinically visible borders. One of the possible reasons for these controversies might be our lack of knowledge about the distributional patterns of Paget cells extending the clinically visible borders. Previous studies have suggested that histological borders may be highly irregular than clinically visible borders. However, conventional methods could not directly assess the relationship between histological and clinically visible borders until now.
How did you do it?
A total of 23 biopsy samples were taken from Japanese patients with EMPD. To directly compare the shape and location of these borders, we transparentized whole biopsy samples with the tissue clearing methods and labeled Paget cells with a specific antibody. Then we visualized the histological borders in 3 dimensions by 2-photon microscopy. These borders were compared to the clinically visible borders defined by dermoscopic images of the same samples.
What were your main findings?
2 spreading patterns of Paget cells in subclinical extension were detected, satellite and continuous patterns. However, the frequency and the broadness of subclinical extension were much smaller than previous reports analyzing Caucasians. Furthermore, we also found that histological borders were not highly irregular as the clinically visible borders.
Why is this study relevant to dermatologists and their patients with extramammary Paget disease?
The major discrepancy between our findings and published data may be explained by other factors of EMPD, such as skin colors of patients analyzed. In other words, lesions detected as hypopigmented patches in colored skin in our study might become less visible in less colored skin, resulting in much frequent and broad existence of subclinical extension. Therefore, Asian patients with EMPD might be well treated with narrower margin than Caucasian patients. Furthermore, it might be beneficial to enhance the melanin pigmentation before defining the surgical margin in EMPD patients with less colored skin.